Hi, this is Jurgen Rasmussen. Welcome to the Provocative Hypnosis Vlog. This episode is about why clients sometimes get worse. Sometimes people can go through cognitive behavioral therapy, hypnotherapy, mindfulness programs, and other forms of change work. And instead of improving, they come back and they actually feel like crap. They say, I'm way worse. I have, my feeling, the intensity of my symptoms have increased. I have a lot more thinking going on. And sometimes you may then, try something new with them, some other approach, and they come back and they feel even more worse. What might be going on? How could it be that people could come to your office with the best of intentions, and you can have the best of intention, and you show them stuff and you guide them through stuff that's been very useful for a lot of people, and instead of improving, or at least not changing, they actually get worse. Well, here's one thing, or one explanation, that's a very good candidate and a proposed solution. So I very often say to clients, look, if you were to ask former clients of mine who used to be stuck in something, who used to be very anxious, for example, if you were to ask them, what's different now that you're no longer anxious? You might get various answers, but if you kind of push them a bit, you'll have a tendency to end up in the same place, which is something along the lines of, you know what? I used to have a lot of thinking around that, and now I don't really think that much about it anymore. It's usually a reduction in thinking volume, way less rumination, way less attaching meaning and significance to something. And what can sometimes happen in psychotherapy and coaching and change work is that clients end up thinking even more because they get even more stuff to think about. So when change work works, so to speak, or when people change, it's very often due to them seeing something new, hearing something new, having an insight, having an aha, now I see that, or now I have a very different perspective on things. They make a discovery, which then kind of allows their mind to conclude or to not take something seriously anymore. So it might be that they see through a psychological illusion. They just realize that, oh my God, this was just made up. That this was just this idea that I have. Or they learn how to relate to their thoughts in a different way so that they no longer necessarily, identify with their thoughts or fight their thoughts so much. So they learn some other way of dealing with their emotions, or they learn to change their thinking, right? But but you could teach someone, for example, a breathing meditation, and that's often profoundly useful for many people. But some people are so busy ruminating that they're essentially not doing breathing meditation. They're sitting with their eyes closed, thinking about their breathing and conceptualizing their breathing and attaching a lot of thinking to it. And they might have a lot of, I have to do my breathing, and what's going to happen with this breathing stuff. And now they just have an additional thing to think about, right? Or you teach them some sort of technique or some sort of process, they're often not necessarily even able to do the process, or they don't see anything new, they don't hear anything, they don't make any discoveries. It just becomes an additional thing to think about, and they end up thinking about that particular process, right? And they may even conclude that, oh my God, I've been given these tools and these techniques, and nothing works, and they lose hope, and now they're depressing. Now They're so it can be a version of what they in medical school sometimes call medical disease, or what do they call it? Medical school disease, right? When students of medicine, some of them, start studying all these diseases, some of them become convinced that they have quite a few of them because they start to fixate on it, right? So with a client like this, just giving them other tools or other techniques or doing other experiments, unless they happen to see something new or have some sort of insights, it's often just going to add to the rumination. It's very difficult to think your way out of thinking because you're just adding more thinking to it, right? It's a bit like taking a dirty cloth and smearing it across the table. You're just smearing the shit all over the place, which is what has a tendency to happen. So I just had a session with a client where this happened, and I gave her a task, and we'll see what the effect is. But I've done this with people before and had very good outcomes. So it's a bit with tongue-in-cheek that I mention words like science when it comes to psychology and psychotherapy. I don't know if you can really call it scientific at all. And of course, psychology has a big replication crisis. So I'll use it as very loose terms. But there is some research done on psychotherapy. And one thing that was very interesting was that just going and seeing someone, for example, every week and talking about your problems didn't seem to have a positive effect at all for most people. Just not addressing stuff either did not seem to be beneficial either. But one thing that seemed to be beneficial was writing. Actually writing about your stuff. Now, there's a guy called James Penbaker, who's a psychologist, who used to work as a university professor. He also ran a practice, and he had some function in a prison. I can't quite remember what that was. But what he noticed was that when people were interrogated and interrogated over time, their stress levels had a tendency to go up. It doesn't take a genius to figure that one out. Now, of course, the highly psychopathic folks probably didn't have much increase in stress level, but for most of the others. But then he noticed something really, really interesting, and that was when people confessed, and we'll have to assume that this was probably just the case with, real confessions where people were actually guilty, because there are people who confess to things they haven't done, because they're afraid of the harsher sentence that they might get, like if you confess now, you'll get this instead of this, So that brings forward false confessions. There's also false confessions that happen as a result of interrogation techniques, and so. But for the people who are guilty and who confessed, there was a dramatic positive improvement in stress levels. And it lasted for several months. You had less flu, less influenza, less arthritis pain, better sleep, less depression, less anxiety, less rumination. And Penbaker was curious because he was going, damn, this is as far away from positive thinking as you can get. What's going on here? And he started doing the same experiment with clients and with university students, and he called it the private confession. Because what he kind of made of this was that secrets are bad, the stuff that we can't quite be honest about, with other people or ourselves. Secrets are extremely stressful to keep. So he had people do an experiment he called the private confession, where they were instructed to take, some trauma, some conflict, something they were ruminating about, that just wouldn't leave them alone, that was just spinning, and to, for 4 days in a row, sit down for 15 to 20 minutes and just write down their deepest thoughts and feelings about the topic. No pressure to be mature, no pressure to solve anything. Never had to show anyone, including Penbaker himself, what they wrote. Just 4 days with this. Sometimes people would feel worse after day one or day two, but I think for 80% or so, the effects were the same as the people in prison. Same positive effects. And a very plausible explanation for this is that when people have a lot of rumination and they don't have a lot of skill in seeing thoughts as thoughts and dealing with them, just giving them, breathing exercises or techniques to do, they'll very often just ruminate about that as well, and that's how people can easily end up worse, right? But writing, when you actually write, you make your thoughts very concrete. You gain distance to them. You gain the ability to kind of see them because now they're put down on paper, and you can have a relationship to them. And your brain gets the chance to look at these thoughts and to create a new story, a new narrative, because the narrative has a tendency to change over the 4 days, and it gets to conclude, right? So once the brain concludes, either has an aha or has an insight, a change of perspective, or go, this is what it means. As soon as the brain kind of reaches a conclusion, the rumination and the stress has a tendency to stop. And doing the writing exercise seems to, not always, doesn't work for everyone, not useful for everyone, but for a lot of people, and especially the heavy ruminators who don't get anywhere by trying to do things with breathing and their thinking and stuff like that. This has been, in my experience too, often a very, very useful tool. Penn Baker also has some books that you can check out if you want to read about his work. But I essentially gave you how to do it. So if you have a client who's gotten worse because their rumination has increased, this is very, very often a good move. So hope this was useful to you. Hope you'll be willing to play with it, experiment with it. If you have any thoughts about it or get any results from it or whatever, feel free to post it wherever you find this video. If my way of thinking and working resonates with you and you want to do some change work or you want to do some mentoring, or you're curious about my online trainings, get in touch with me through provocativehypnosis.com. Thanks.